Mr. Quashie, appreciate you being here again. I'll start with you, sir. I appreciate your testimony highlighting the growing role of wearable technologies in early detection and prevention. I wear Garmin Fenix 8. Training for triathlons back in the late 80s. I had a monstrosity on my wrist. So for those that can relate to those days, this is all new and exciting things that are happening. I'm encouraged that this subcommittee has noticed the discussion draft I'm leading to codify the FDA's updated general wellness guidance. This is a critical first step toward providing the agency with clear direction on how wearable technologies can be used appropriately as screening tools while maintaining strong safety guardrails. Mr. Quashie, can you discuss more broadly the health benefits wearables can provide to our constituents, and follow up with that, and how can they play a role in empowering patients to better track and manage their own health outcomes?
Thank you for that, Congressman. Chair Griffith actually had a great use case for wearables earlier. He was wearing a device. It provided him some data about his own body. Yep. He was able to act on that data and went to his clinician to get more information and more services. That is a perfect use case.
And he shared that story with me too.
He did. Back to something I mentioned earlier, I do think wearables are now the front lines of healthcare. If you think about what the Health Services Administration has estimated, that 105 million Americans, or 30% of the U.S. population, lives in a primary care shortage area. Access is a big issue. Many of us have had the opportunity to call our clinician and only to be told that the nearest appointment is 4 or 6 months out. Wearables are, especially the new gen wearables with the new technology that can measure things such as sleep and stress and respiration and heart health, are an important component in keeping people healthy, providing information that a generation ago would be unfathomable unless you actually walked into a healthcare facility. So to us, as CTA, we think wearables have now become the front line of healthcare.
Agreed, thank you. Follow-up, sir. As Congress continues working to modernize regulatory pathways for digital health, what additional steps should we consider to help ensure the FDA can effectively incorporate wearable-enabled screening tools into prevention and care for earlier in the patient journey?
I think the only advice or recommendation I would have is for all of us, policymakers, stakeholders, we need to be nimble and flexible because this technology is advancing at such a pace, and often legislation and regulation don't keep pace. So we need to be very nimble, we need to understand where the technology is going, and we need to be creative about potentially alternative regulatory pathways to ensure the safety of these devices.
Thank you very much. My next question is for Mr. Ulmer. Mr. Ulmer, thank you for being here today. And I know that several of my colleagues have brought up part of my questioning here, Ranking Member DeGette and Representative Carter from Georgia. But I do want to see if we can emphasize a little bit more. Nearly 250,000 Ohioans are currently living with Alzheimer's or dementia-related illnesses. In rural communities, too many individuals are never diagnosed or they are diagnosed too late. Primary care providers are often the first point of contact. Yet many report they do not feel confident in diagnosing and managing dementia care. I'm proud to lead the bipartisan AADAPT Act, which is being discussed today and would strengthen and reauthorize the Project ECHO program, a tele-mentoring model that connects frontline providers in rural communities with specialists through virtual training networks. Mr. Ulmer, from your experience, how can training models help improve the diagnosis and care for people living with Alzheimer's and other dementias?
Thank you, Congressman Balderson. Community health centers see almost 4 million nationwide seniors. And when you think about dementia, our primary care providers may not necessarily be the ones who diagnose that. However, with programs like the ECHO project, we're able in our most rural areas to literally get on the phone and speak with a consultant who could diagnose our patients. So this program is crucial, and we appreciate this bill because it will strengthen access to these vital services with the specialist right there immediately with our primary care providers in the exam rooms with those patients. So thank you.
Thank you, sir. And I have another follow-up question, but I'm going to be out of time, so I will submit that. Thank you, Mr. Chairman. I yield back.